I'm Dr. Hans. Back in 2000, I got my MD and started on a path of internal medicine and infectious diseases. Then in 2017, my son was diagnosed with SYNGAP1 syndrome, and I became a rare disease advocate. In 2021, I joined industry so I could work on rare diseases as much as possible. And I can't help but talk about rare diseases. It's incredibly exciting, and thank you for listening. So beyond indulging my own interest in talking about rare diseases, and it helps me sort of formulate and crystallize thinking for my son and projects that I'm on, it's clear that talking about rare disease advocacy is something that members of the community can benefit from. Maybe it's a few, maybe it's many, I'm not sure. But I've heard enough people in my general circle talk about it that I've set this as a goal for myself. And let me just immediately say thank you to my daughter for the kick butt background I've got behind me. And then also Ray of KWB Media for his forbearance, for his teaching, for his patience. Because it takes a while for an introvert to get in front of a camera. And what I'd like to do is just start with a background, just so that you know who is speaking, like what their biases could be, and the angle that they're coming from. And it may resonate with you and it may not. But, back in 2015 when my son is born, I'm doing the infectious disease doctor thing. At that time, we were in the greater Philadelphia area. And, during his development, he's got the ma going on for his babbling. And you say to yourself, okay, mama's going to be his first word. And then at around probably, let's say, 10 and a half, 11 months old, it's really still fresh in my mind. We're there in the dining room, him in his high chair, tray in front of him, table here. And I think to myself, where did the babbling go? And it's as if a piece of glass breaks in the background, distant, but it's the realization that something is really wrong. Because even without doing, extensive pediatric training the way a pediatrician would, you still get all the lectures in medical school. You get, I think it was 12 weeks of a clerkship in pediatrics, and I still have fond memories of it, mostly fond. And you leave with a understanding that a milestone gained and then lost is damning. So that realization really just throws you into the deep end of something's wrong, and this is very serious. And I think a good analogy is the stages of grieving related to death, the sort of Kubler-Ross stages, where you go through shock, denial, anger, bargaining, and then acceptance. It's a little bit different, but the similarity is close enough that I think it's useful. And, denial happened. There's no doubt about it. The pediatrician, I recall, their office called and said, oh, she's going to be out of town at a conference. Can we reschedule that 1 year-old appointment? Sure, yeah. Whatever's convenient, right? I'm not eager to get there and hear terrible news. And it took a couple of months. And then we got in with the doctor, and sure enough, it's, hey, do you mind if I send in early intervention? Just, screening routine, right? It's like, sure, it's routine. So they come in and they ask questions and sort of, spend a few minutes with him and clearly pick up he's a quiet kid, which is not good. And it kicks off the diagnostic odyssey, right? And you see, Effie Parks has this great sort of map of the rare disease odyssey, similar to the Iliad and all the pitfalls of the main character, and adapted to the relatives who think everything's going to be fine. He'll be 4 years old and suddenly say, "Why does everybody think I can't talk?" Or simple remedies that will fix everything. And for us, it becomes this referral system of dev peds, metabolomics, neuro. You've got to go see genetics, da 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 da. And thankfully, we were in a major referral area in terms of being in Philadelphia, having our pediatrician at CHOP. So that helped things. It still took months. And at times, you sort of scratched your head about the whole experience. So I remember I was sitting with a doc who, writes the textbook in their field. And we had already had a negative karyotype and, a look at the basics of the chromosomes. So we were already prepared for doing next generation sequencing to get our answer. And this doctor said, if I were you, I wouldn't do genetic sequencing. And here's why. One, it's unlikely to show you a result. Two, that result is unlikely to explain what's going on with your son. Three, if it does explain what's going on with your son, it's very unlikely that there's anything you can do about it. And four, it's really expensive. And obviously, the entire time, I'm thinking to myself, you just don't get it, buddy. And you just smile and nod. Oh, okay. All right. Well, that's food for thought, isn't it? Yeah. Thank you. Of course, when we did get our answer and sometime into that, I emailed the person, and I encourage you to email a doctor to give them the follow-up, because education is a daily experience in medicine, and patients are a part of that. So I let them know, and it was very important that we got our diagnosis. And that took until the beginning of March 2017. And that's when, the whole exome sequencing came back. Still picture it, sitting at the desk at work, genetics counselor gives us a call, let me, conference in my wife so we can hear the news. You found something, okay. It's called SYNGAP1, got it, okay, this, and this. And then they close, of course, with, have a nice day. I had to write them an email too. So there's better ways to end that conversation. But we got our answer, and then it's, off to the races, try to find something that helps my little guy, landing on nonsense read-through, since he has a stop codon where it doesn't belong, sort of a stop sign that we want to just blaze right on through. And we get our referral to sort of genetic epilepsy, because that's part of the syndrome. And maybe I should explain that SYNGAP1 is an intellectual disability with seizures, behavioral issues. There's a percentage of autism associated with it, and a plethora of other things. So we wind up seeing a great guy, Dr. Marsh at CHOP, sort of talk about maybe using azithromycin for nonsense read-through. Okay, all right. The ID doc wants to use an antibiotic. It's on him. Okay, sure. So we try that, and we're, hoping to hear, let's say, more verbalizations out of our little guy, and it's not really working. Contacted PTC Therapeutics, because Adalurin also was sort of in development at that time for nonsense read-through, more in cystic fibrosis. And I wrote them and said, I'd love expanded access. They were like, wait a minute, you're the dad. Oh, we don't do that. And I can understand that. You gotta stay reasonable, right? You gotta manage your expectations. Dr. Marsh said, sure, I'll send a letter too. And they got back to him saying, well, there could be something maybe in the fall, so let's keep in touch. Okay, a little bit of hope there. And Also, around this time, um, I made it over to Global Genes. I had a drug development conference. I think it's every May in Philadelphia. And in 2017, they were beginning to report the results of Zolgensma in the spinal muscle atrophy babies. And I just remember sitting at this, large table, and you're watching the videos of these babies who, many of them would have been doomed not to see their first birthday, right? And they're sitting up and they're breathing on their own, and it's hard to find a dry eye in the entire place. And coincidentally enough, there's a SYNGAP advocate at my table, I believe from Northern Ireland at that time. There was also a great guy from adult polyglucosan disorder. The community was, really a great vibe. You're in a group with people on a mission, right? And that's fantastic. If you can work with passionate, smart people, you're blessed. And in the community, it's overflowing with people who are obviously on a mission, right? So, attending the drug development conference was great, and asking questions and trying to, provoke a conversation based on some of the experience I had in translational medicine, in, working in infectious diseases for years before that. And using NIH Reporter, I landed on Marcello Coba as a researcher at USC working on SYNGAP. So wrote him, trying to not come across as some crazy dad. And he was kind enough to get back to me. We had a phone call. And then he actually came out to the Broad Institute for a conference, I believe, and said, we can meet up in Cambridge if you want. And in the fall of 2017, late summer, we had moved up to Massachusetts, so it was really convenient. And he said, if you want, I can collect a blood sample from your son through your doctor and turn it into iPSCs. These are induced pluripotential stem cells, so he can look at stem cells derived from my son. And that's what he did. And it was just fantastic in the sense of feeling empowered that, there was a difference, right? Or a path towards helping my son. Besides eosinophilomycin, and then coming up in the spring of 2018, what happened was, we met our doctor at Boston Children's, said, would you mind using the same letter to ask PTC Therapeutics for expanded access to Adalurin? Sure enough, she was willing, they were willing, and everybody turned it around pretty darn quickly, including the FDA. And I am a fan. So besides, getting a blood sample into a lab, sort of workflow, and then also Adalurin into my son in March of 2018, it felt great. Absolutely. As a parent, you're doing whatever you can. And it may not have the happy ending, but you tried, right? There is no regret on what could have been done. So we had, connected to some researchers, gotten access to Adalurin, and we're doing that. And then in the spring of 2018, my doctor said, do you want to talk to a family out in California that were recently diagnosed? I said, sure. And Ashley and Mike had clearly done a lot of due diligence on behalf of their son, looking at the community and advocacy, and said, what do you think? And I was like, I'm not a good fit for the patient advocacy group, so I'm just going to do my stuff on my own. Are you thinking of starting your own group? I said, no way. No. Being a doctor, breadwinner for my family, 2 kids, ain't happening. And you can see that it's a full-time job. Because down the road, Mike was doing it sort of part-time, and it is a full-time job. He had to give up his job. It's totally understandable. And, at least there was a real interest in just getting some science in the door. So Marcello Koba needed so they asked if I would do the science if they started a group, and naturally it's an opportunity to step up and you don't say no. And down the road, I don't even like spending my own money, but other people's money, no way. And it was just get some science. And Marcello and I spoke about how his lab could use a Willow MEA, multi-electrode array. Not so expensive that you ask the NIH for it. Not cheap that you would ask your institution to pay for it. But right in that sort of $50,000 sweet spot that was the first thing I was involved with in terms of funding advocacy science or using advocacy funding to support science in SYNGAP. And after that, talking about other ways to help the community, the ICD-10 code is its own saga, and I'll cover that, but I don't want to come across as completely crazy right now. Then after that, it was ICD-11, which is going to be its own sort of podcast topic. And in 2021, a buddy who I had worked with in Philly in infectious diseases needed his hospital credentialing renewed. And the hospital reached out to me and said, can you vouch for this guy? Have you worked with him in the past 2 years? And he had already moved on to industry. I wasn't sure exactly where he was. And I reached out to him and said, hey, how you been? Sorry, I can't do this for you, but it's been over 2 years. And he said, thanks anyway. I'm at Sanofi working in rare diseases. And I said, you're working in rare diseases? I ought to be working in rare diseases. And he said, well, look, there's a job open, and if there's a 5%, 1% chance that you join, why don't you do it as a job talk? So that was February of 2021, and I made the leap to industry in July of 2021. So, since that time, it's been just a fantastic experience of people who are passionate to push drug development across that distant finish line. I mean, it is so much work. I can't go into it in too much detail. I have to recognize that I have my bias there, and I'll summarize that, I guess, at the end. More recently, trying to push for my son, collaborating with a Dr. Joe Anderson, who does research on what's called ex vivo lentiviral correction. And this is a treatment for the kiddos with X-linked adrenoleukodystrophy as well as metachromatic leukodystrophy. It seems to work, and it's very interesting. They believe maybe there's... Anyway, that's me getting into a tangent that's really, really interesting. But what Dr. Anderson and I did over the summer was reach out to the FDA for an Interact meeting. And that was really the highlight of my year. And I'll talk about that as well at some point. But just to recap, you're listening to a person who is a bias for, let's say, patient-centered healthcare, right? 20 years as an MD, and a bit of a stickler or idealist based on how I was trained. You've also got a person who's biased for the FDA. I think that they have a near impossible job in the sense of you can please some of the people some of the time, but not all the people all the time. They have helped my son through the quick turnaround of the individual IND for Adalurin. That took like a week. I was shocked. I thought it would take a month or two, and it pained me in anticipation. But they're fantastic. And then over the summer, having our Interact was also a great experience. So you're not going to have a person here who like trashes the FDA, which seems to be vogue in a way. Also, I'm clearly biased for industry, and I'm not sure where else good treatments come from. And there certainly is this symbiotic relationship between brilliant ideas in academia, making their way into industry or biotech to be developed, and together working towards treatments. And that's very inspiring, and it's going to be a bias in my perspective. So be aware. And there's obviously financial aspects to it as someone in industry, where you might, once a year get a discount on buying stock or whatever. So take that commentary maybe with a grain of salt. I will be honest about certain things that bother me, but it won't involve my employer. I think that you're going to hear a degree of mixed messaging. I think the parent of a rare disease child or loved one is really in a unique position, right? Because I don't want to feel like I'm on a mission to fix my kid, in the sense of, that negativity of him, that needs a repair. I want to face the idea that he may not improve, and I will love him nonetheless, but I'm also going to work like hell to help him. So there's a delicate balance there. And there's a level of anxiety too, right? Because nothing happens fast enough. And even the people that I call friends, I don't know, I warn them that I have an anxiety to help my son as quickly as possible. So hurry up. And what I'd like to do is just show you real quick, if I can, a quote from a really great TED Talk you should watch.
Recently, I told a friend that I consider myself lucky. And he gets all surprised. He's like, even with the mutation? And my mind was kind of blown, because this is me. There's no version of my life where you subtract the mutation and hold the rest constant. On the one hand, I got dealt a bad card, and don't get me wrong, I really don't want to die young. At the same time, this bad card has launched me on a quest with a team. And the wonder of this exact life is that I am constantly getting to meet people's best selves, including versions of Eric and me that I wouldn't have encountered any other way. Does everything happen for a reason? I don't know, guys. Probably not. And yet, here we all are, making our own grace out of the darndest raw materials. It is not such a bad thing to be called to notice.
So hopefully at some point, or on a more consistent basis, I can feel lucky, you can feel lucky, but that's what Sonia here, Vallabh, describes in a TED Talk, and she's racing against the clock for a prion disease. And it's an amazing story, and I hope you give it a watch, because it's really true that with acceptance, with the ability to help your loved one, there is, for me at least, a feeling of being lucky. And I like the person that my son has forced to evolve, and what I've become. So, it's a challenge, but I hope you wind up at a similar place. I've heard a lot of parents say, I just can't keep doing it all. And that's totally fine. There's never meant to be any sense of guilt. That's at least my experience as a doctor speaking. just validation. And that's usually what I say in the sense of, look, just stick to rule number one, and that's taking care of your loved one. It doesn't have to involve doing a fundraiser. It doesn't have to involve going to a research appointment. The most important thing is just take care of that loved one. And it's similar, I think, to what you hear athletes say when a star player goes down. It's like, well, it's an opportunity for someone to step up. And that's absolutely the case. It doesn't rest on any one person, but other people can step in, step out, come back again, take a timeout. But that's essentially what I'm going to try to talk about. It makes me feel lucky, at least, to talk about the amazing atmosphere that rare diseases are in right now. And if you have a topic, please just drop me a note. Thank you, Madeline, for sharing what sounds like a difficult experience. That's putting it mildly. And I'll try to cover that in a later talk on the transition from pediatric to adult care. Great. Thanks so much.